Hello and welcome to Med News India. Today we are privileged to have with us Dr. Amit Chaudhary, Director of CTVS at Asian Hospital, Faridabad. With over 18 years of experience and more than 5,000 successful heart surgeries, Dr. Chaudhary is one of the leading cardiac specialists. Doctor, thank you for joining us today.
Thank you.
So, Doctor, how do you explain TAVI to a patient who has never heard of it?
It's very simple. Everybody knows about heart surgeries, and we all know that heart surgeries have been plagued with being very brutal, very invasive, long, tiring OT sessions, long recovery time, rehabilitation time. So, since the advent of this technology, which is actually the replacement of heart valves through catheter-based assembly, which is actually called TAVI, is into play, it has totally changed the whole outcome and acceptability of treatments of heart valve diseases. So this is something which offers us totally minimally invasive or sometimes non-invasive cardiac surgery, which can be done in cath lab in 45 minutes, which used to be done in 8 to 10 hours.
What is the most common fear patients have about TAVI and how do you reassure them?
I think we still need to educate people because there are a lot of fears, myths among the masses, like whether this TAVI will be successful or how this valve is going to hold in place when you are not suturing it. With our experience, we have seen the biggest fear among patients is that whether this will be long lasting or how long it will last and whether we will have to go for another procedure in future. So I would like to assure them as well as caution them that these valves are basically based on tissue valves. Tissue means it can be bovine pericardium or porcine tissue. They have their own life. So similarly, they are offered to those patients who are usually above 70-75 years of age or who are a high surgical risk. So they have also to be carefully selected according to the patient.
So, Doctor, artificial intelligence is transforming healthcare. How is AI helping you make better decisions in operating room?
Which is going around the globe, artificial intelligence here is also playing a role in improvising our approach towards the treatment. There are technology and virtual image related technology which can be, mixed with MRI data and CT data and, let us walk through the whole procedure in virtual reality and see exact the valve and the place and the valve we are going to put, how it is functioning. So there are a lot of innovations going on. There is a lot to come, but still there is, a play of AI, which is helping us and keeping us innovating ourselves.
What is the most exciting research in cardiology that you're currently following?
I think minimal invasive surgery is something which has changed the whole perception of masses when they look at cardiac surgeries, because this is one arena where there was a lot of scare and hue and cry whenever any patient goes for cardiac surgery. The attendants are very much scared and apprehensive. What will happen to them, whether they will come back or not. And I think this minimally invasive surgery has totally changed the outcome, what we get today.
So, Dr. MICS or a minimally invasive cardiac surgery is often referred to as the future of heart surgery. How does it compare to traditional open heart surgery in terms of recovery and long-term outcomes?
There is no doubt that coming time is, future of minimal invasive surgeries. But then definitely, as I already said, these procedures have to be carefully selected as per the patient's need, indication, requirement, and they have to be custom designed for every patient. You can never replace conventional procedures or surgeries, but then there will always be place for innovation and improving the outcome with newer and newer techniques of minimally invasive procedures. So we have to keep educating people, we have to keep educating the doctors, the surgeons to carefully select these patients, and yes, it is the future of cardiac surgery.
After nearly 2 decades in the field, what still amazes you about the human heart?
Being a cardiac surgeon and working for almost 25 years since my training period, heart is one organ where we can totally stop this dynamic organ, put the patient on machines, bring down the temperatures to 12 degrees, and this is the condition which is called total circulatory arrest. It is actually a near-death kind of scenario we create sometimes when we have very complex procedures, and it gives us 45 minutes of time to operate and come back on the circulation support. And this is something which is very unique with this organ, which is not with any other organs. And heart starts and starts functioning back normally, which is actually amazing.
That is it for today. Stay tuned to Med News India for more expert insights and the latest updates in healthcare. Don't forget to follow us for more exclusive interviews. See you next time.